Esteemed colleagues, we are starting our next press briefing. We'll be talking about assistance of international volunteers to our warriors who are at the front line. In Ukraine, there are dozens of voluntary organizations. And what is the contribution of international volunteers, what they manage to do, what problems they are facing? That we'll be discussing with Olga Durbak-Chuyko, who's the representative of Charity Fund, International Association for Support and Development of Ukraine, Mr. Kurichka from the Border Service of Ukraine, and Mr. Maranich, the chairman of the board of the NGO Plitch. Good afternoon. Good afternoon. First of all, I would like to thank the moderator. I would like to thank the Ukraine Crisis Media Center for invitation and for having this chance to talk about our activities. Our organization, our fund is set up due to the efforts of volunteers from all over the world. During our events at Maidan, our first task was not to allow our guys who were wounded so that they have the feeling that they are abandoned. There were so many wounded people, and the situation was very complicated, and so we were writing letters. We were sending letters to the hospitals in Europe and the US, and we were receiving immediate answers. They were looking forward to receiving our requests, and they were also requesting different NGOs, different funds. Our fund wasn't registered at that time. We registered a few months ago. And just like during the events at Maidan, now during this ATO, the operation which is so needed, so necessary for the true independence of our country. We are not aside, we expanded, we got legalized, we opened the rep offices in 7 countries, and we are trying to provide assistance in medicine. We are rendering medical assistance to our warriors from the Ministry of Defense, Border Guards, the National Guard, the Security Service of Ukraine, so that they are healthy. I had an opportunity to invite one wounded person. We are planning to send him for treatment to Austria. I did not invite him. I asked myself, what is more important, for him to tell that he will go there for treatment of his health? Okay, I believe his health is more important. After he recovers, he will tell us about what has been done. Most of the hospitals that we requested were unable to provide assistance to him. So that's briefly about wounded, but not to have so many wounded. People need protection, and they need medical assistance down there at the battlefield, so that they, just like in Maidan, they have no feeling of being abandoned. Unfortunately, we cannot do everything, but test to this feeling of the being abandoned. But we are trying to render assistance. We are trying to provide medical support, painkillers, blood stoppers, all these individual medical kits. Association signed an agreement with manufacturers of Celax for a unique price. We have the chance to purchase. These are money volunteers from all over the world, Ukrainians and all other people. They accumulate their private money. They give their money to Ukraine, and We have the suppliers who know how quickly we then send all these things to the front line so that every person has the individual medical kit, so that people can be sure that in case of being wounded, they have the chance to survive. Now, Mr. Kurichka, the representative of the State Border Service, thank you to all of you, to all people who are involved into that event. And first of all, I would like to thank everyone, and I would like to mention that she doesn't receive and she doesn't want to receive gratitude from every warrior, from every wounded person. She will get the gratitude from their parents. She will get gratitude from each one of us. We can feel that now we are getting either individual medical kits or the people are sent to for rehabilitation. One of our officers who's seriously wounded will be sent to one of the Western countries for medical treatment. But one thing is to render immediate assistance, and another thing is to get the person rehabilitated. We cannot even imagine how much human efforts are needed, not just money. We're doing one common cause, and we are achieving a positive result for our country. Thank you. Good afternoon. In fact, there was no chance to get prepared for the presentation. Just a few hours ago, I learned that there is an opportunity to say thank you to Olga Durbak-Chuyko. You know, this little woman, that is lady that is next to me, within these 3 or 4 months. And that is the time when our fund is taking care of our servicemen. Well, she did much more than any civil servant. And just people who come for assistance, they get assistance. Sometimes people say to talk is much easier than do any physical labor. But she's doing a lot. She was even doing a lot of physical hard work. And I would like to thank her on behalf of all the guys, of all the people from the security service of Ukraine who were not left alone. They received assistance when they needed it, in the scope that they needed. It was on time, and it was very important. I don't want to mention anything bad, but I will just request, I would like to request every civil servant, the military or the civil servant, I request you to use these 2 centimeters of power that you have, not to tell people who want to help why this cannot be done. Better tell them how this could be done. Help them do it. I don't want to talk about bad things, negative things. I just imagine what results we could have had in treating our guys, and maybe even in military actions, if the civil servants hadn't been hampering, if they had been helping us in what we are trying to do. Thank you. Thank you, Olga. Thank you, colleagues. Do you have anything else to say? Yes, I would like to add. The colleague was talking about these tender hands. This cannot be calculated in kilograms or tons of volumes. In the nearest days, we will receive the beds in such numbers that this will be enough for our hospital and the regional hospitals. The rest of the equipment which is needed for functioning of the different departments, medical departments, these are things which are so needed today. We are talking about the need that we have today, not tomorrow. I would like again to thank Olga for what we will receive in the nearest days. Thank you. Then I have a question, first of all, to you. Please come closer to the microphone. How fast the assistance and this fund is the International Association for Support and Development of Ukraine, how quickly it gets to the warriors. What I'm talking about, this will happen before the 1st of September. So basically, you managed to resolve all these bureaucratic procedures. Well, today is the 21st, and on the 22nd, we will get what we need. What you need? The beds for the departments of our border medical hospital, border guards medical hospital. The total will be up to 10. Then my question is to you, Olga. What problems do you face with what you are doing? Because we had here many representatives of charity organizations who are ready to do a lot, who are ready to supply individual medical kits and medical equipment, but there are certain procedures. Some of the things are not registered, not licensed, and they are staying at the warehouses and they cannot reach the soldiers. So what problems do you face? Yeah, we have similar problems, very similar problems, because we live in the same country. The International Association for Support and Development of Ukraine is an international charity fund. We are present in several countries of Europe and US and Canada. Basically, we are lobbying the issue of special permits for bringing certain things from other countries to our country. And also it is important to receive it. Talking about medical kits, we have very similar problems. We know that if the goods are not certified, we cannot get it, but we have some progress in that. We have an opportunity to get a special permit from the Ministry of Public Health for importing the medicines and medical equipment. That is the special permit. That is a single entry, but that's some chance. I would like to emphasize this press conference and the fact that we invited to the press conference. First, for the first time, we received from Germany 20 tons of assistance from Germany. That is not a governmental assistance, but these are German volunteers, some Austrians, French, who immediately put together all these necessary things. They, by their example, they set an example to other organizations. People were saying, just listen In Germany, they treated 88 patients, and in France, we have not treated anyone. And let's take someone. That is an example. We can be proud of our country, not just here in Ukraine, but outside of Ukraine, because that is not just the fashion for everything Ukrainian. Now, talking about equipment, 20 tons of equipment and medicines and the medical use. These are the special pneumo mattresses. That is a so necessary component for quick and safe transportation of seriously wounded people from ATO zone to the hospitals. Different special beds, very special and simpler beds. These are different bandages, the wheelchairs, the supplies are helping me. The uniform, special, oxygen masks and so on. How do you distribute that? We'll distribute it to everyone. Probably everyone needs it. So some organizations addressed us, came to us, the hospitals, regional Kiev hospitals, medical institutions, field hospitals, also children's institutions. After I received the request in Kiev and Ukraine, we immediately sent these requests to our rep offices in Europe and America. We're waiting for the second transport. We have been helping in organizing treatment, and we will continue to do that. I came to the hospital. I see our guys are 19 years old, and it's difficult to find words that we can. It's easy to say that our foundation will help you, but it's difficult to say because our first task is to raise medicine here. We are trying to motivate its development in different spheres and management and getting medical services. We're a European country. And second is to develop the industry of orthopedical, and also not to allow the fact so that our warriors are not disappointed. That's what I survived through at Maidan. We don't want people to be disappointed. And we passed this non-return point. Thank you. Any other questions? I will remind you, we have Olga Durbak-Chuyko, representative of International Association for Support and Development of Ukraine, Sergei Maranich, chairman of the board Plечо-Plечо, and Alexander Kurichko, the representative of the State Border Service of Ukraine. Once you have may I add a little more? Olga did not emphasize because she's too modest. I would like to correct. It's not pneumo mattress, because maybe people pneumo tire. That is, if you understand, that's some special device which is so important for transporting people, not from the field, but which is needed later during the transportation in the aircraft, in the helicopter. And the wounded person should be fixed so that we really can get this person to the hospital. Not every um, hospital would have this pneumatic tire.
Нагадайте.
8.
8.
And there are 8 of such pneumatic tires. And that is not single-use material. That is a medical device which will serve for long. After the war's over, we hope it will be over soon. If you have no questions, I would like to thank Olga. First of all, thank you for what you are doing, for what the whole world is doing that is helping Ukraine. Thank you, and our next press briefing is at 5. Thank you.